Latest on monkeypox. The CDC recording more than 14,000 confirmed cases in the U.S., 11 of those children. This is causing a lot of unease for parents as kids across the nation are heading back to school. So let's talk more about it with ABC News medical contributor and emergency physician, Dr. Darian Sutton. So, Darian, kids across the U.S. have already started to return to school, including mine. More will be heading back in September. So what do we need to know about monkeypox in our kids right now?
Well, first and foremost, I would advise parents to remain calm. Luckily, the cases of monkeypox among children remain rare, and we can still use a lot of the techniques that we learned during the pandemic while also reminding ourselves of what monkeypox looks like and how it's transmitted. Things like hand washing, cleaning surfaces, and even wearing masks when in crowded rooms will help to reduce the risk of not only monkeypox, but other infectious diseases. And because this is a virus, monkeypox, that transmits via contact and close contact, the risk for school-age children is actually higher at home. So making sure as parents you have no new symptoms, and remembering, regardless of the cause, because kids can often get various rashes with their fevers, regardless of the cause, a child with a new rash or a fever should be held at home until we confirm that they're not contagious.
So earlier in the COVID pandemic, we saw schools taking safety measures by implementing mask mandates, other regulations, but many of those measures are now gone and nothing is really set in place when it comes to monkeypox. So what precautions can we all take if parents are feeling uneasy about sending their kids to school right now?
Yeah, I can understand why parents would be exceptionally frustrated in the setting of the pandemic of COVID-19, which is still ongoing, and then we have these outbreaks of monkeypox. I would advise parents to remind their children of how best to protect themselves, practicing hand washing at home. Even some parents, and I think it's okay, taking a shower and changing clothes when you get home. I see, for example, my emergency room as a very dirty environment, and so I'm more likely to take off those scrubs and take a shower after that event. And I think the same can be done for school-age children. And then, of course, I think for your child, advising them to wear a mask. I think it's still completely appropriate and helpful to help prevent the spread of disease.
All right, let's talk about E. coli while I have you. There's this outbreak in Indiana, Michigan, Ohio, Pennsylvania, at least 37 people across multiple states now infected with it after they reported eating sandwiches, apparently with this romaine lettuce at Wendy's fast food restaurants. So let's talk about what we need to know and do now if we think we've been infected.
Yeah, so E. coli is a normal bacteria that lives in our gut, and there are certain strains that can cause increased harm. Oftentimes, E. coli can spread via unsanitary conditions, whether that's through procurement of the vegetable or the leafy greens that it's often transmitted on, or whether it's inappropriately stored or inappropriately prepared. The symptoms can include things like nausea, vomiting, and diarrhea, and often are self-limiting after exposure. But for some patients, it might progress to severe symptoms of dehydration, which they need to see a provider. To help reduce the risk, basic precautions like hand washing and making sure you don't cross-contaminate your foods and keeping your poultry separated from everything else in the kitchen will help you reduce your risk of getting infections from foodborne illnesses. And then one other note that I have to say as an ER doctor is I often see patients running out to grab antidiuretic medication. I would caution against that. Although it can help with symptoms, it doesn't treat the infection. And in some cases, Kira, it can worsen the outcomes. So I would make sure you see a provider before taking any medication, even if it's just over the counter.
Okay, great advice. Dr. Darian Sutton, thank you.
Of course.